David Steele is in his late 40s. He exercises regularly, watches what he eats, takes care of himself. But because of a family history of prostate cancer, he also gets his PSA checked during his regular checkups. PSA is the test given to diagnose prostate health.
I requested it, and sure enough, it went from a 3 to over a 6. And if I didn't get it tested and would have waited till I was 50, the doctor said I wouldn't be around now, or it would be like in my bones.
Typically, there are no symptoms for early stage prostate cancer. When it's spread, when it's in its later stages, it tends to go to your bones and it can become very painful. We will occasionally see patients that have urinary symptoms, obstructive type urinary symptoms, that they may think is a normal course of aging with enlargement of their prostate, but in some instances that can be a sign of prostate cancer. So again, that would lead us to a PSA test.
Statistics show that prostate cancer is the second most common cancer among men, with African American men being most at risk. But how often should men get the PSA test?
Traditionally, we've done it every year, starting at age 50. There's some data now that if you have your first PSA at 50 and it's less than 1, with the normal being up to 4, you could probably do it every other year. So you don't necessarily have to do it every year. If you're 50 and your first PSA comes back 2, which is still in the normal range but significantly higher than the average PSA, those guys we would recommend either every year or even every 6 months.
Dr. Watson says in most cases, early diagnosis leads to proper treatment, which leads to good results.
I would say, you know, with the way the treatments have evolved over time, the side effects certainly from surgery are becoming less. This robotic surgery has made it a much easier procedure for the patient overall, and they recover much quicker.
After successful surgery, David is now cancer-free, and he has some words of advice.
Whenever you're getting your physical, have them do a PSA test. You can at least you can get a baseline. Don't worry about it. You're getting your blood test anyway for the physical. So have them throw in the PSA test. Hopefully it's going to be great, but at least you could see if it's creeping up or not. So that's my advice.
For Novant Health, I'm Jack Brayboy.